The following portion of Studio 512 is sponsored by Texas Oncology. October is Breast Cancer Awareness Month. It's a time to remind women about the importance of screenings and early detection. Today we're joined by Dr. Aimee Mackey with Texas Oncology, Texas breast specialist. She's here to talk about advances in breast surgery, what sets their approach apart, and how patients can find expert care close to home. We're happy to have her. So Dr. Mackey, we're starting with how breast cancer care has advanced so much in recent years. I'd like to hear about any exciting developments in breast cancer surgery today.
I think there's a lot of new things coming out on the horizon. I think breast surgery as a whole has changed over the last, 30 or 40 years. Historically, we used to offer really lumpectomy or mastectomy. One of the problems with lumpectomy, which is when we save the breast, is we were leaving big divots in the breast. And patients don't love that. And so what we're really trying to do is say, okay, well, can we do a lumpectomy but also preserve the cosmetic part of the breast? And so by doing that, what we're gonna now do is oncoplasty. On the mastectomy side of things, we now do nipple-sparing mastectomies, where we're able to do a nicer sort of reconstruction with that. And then we also are doing some nerve-sparing stuff with mastectomies, which is hopefully gonna be able to preserve some of the sensation of the nipple.
What sets your approach apart from other breast surgery programs?
I think since Texas Breast Specialist is within Texas Oncology, we are able to kind of give that multidisciplinary approach. Earlier today, I was on the phone with one of the medical oncologists talking about a patient so that we can kind of come up with that plan together.
How do you help patients feel supported from diagnosis, which can be a really scary time, all the way through to recovery?
Yeah, I think Texas Oncology does a great job of sort of offering up a lot of that with social workers that can help plug you in with the right people. The other thing is there's an organization in town called Breast Cancer Resource Center, which is a nonprofit that we work with really closely, and they offer a ton of support for our patients. Also, a lot of the hospitals that we work in have their own sort of navigation services that can help people navigate this because it's a big lifestyle change.
So if someone watching today thinks they or maybe a loved one is at risk for breast cancer, what's the best way for them to get started so they can learn a little bit more about breast cancer care?
TexasBreastSpecialist.com is an easy start. Everybody's got the internet nowadays. That could get you plugged in with somebody in our office. Most people will know somebody who's been through this journey. Ask them about it. How did you get seen? Reach out to your regular doctor. Hey, I have something that feels off. You'd rather get it checked out and be wrong than sort of ignore it and it be something that we need to know about.
Totally agree.
Yeah.
All right, doctor, thank you for your time today.
Yeah, happy to be here.
To request an appointment, visit TexasBreastSpecialist.com. The preceding portion of Studio 512 was sponsored by Texas Oncology.